I once had a patient that came into the office here. She initially came in because she had a desire to lose weight and was unaware that she was on the path to developing, well, not just developing diabetes, but was pretty knee-deep into it. Her A1C when she first tested with us was just over 11. Go ahead and Google what that means if you don't know what it means. It's about double what it should be, which is a big deal. What's really important to understand when working towards improvement of that status is that it does take effort. It takes intentionality. It requires the individual to make lifestyle changes, which sometimes can be a little bit difficult, but with our functional wellness system here, we make it as easy as possible for people to make those decisions in the right way. So she had a runway of about 3 months time period where she started to implement some not too difficult changes. She started to change the way she was eating. She supplemented with a couple important nutrients. She started to do a little bit more physical activity. And at the end of that 3-month time period, she was down to about half of what she was before. Her A1C got down to about 5.7. So I won't pat myself on the back. It's nothing that I did. She just did a wonderful job of making those changes, and she had a process that she was able to follow to get there, which I think is oftentimes the most important thing.
Dr. Hill, I also had a patient who came in for weight loss, and when we did blood testing on her, we measured her A1C. Her A1C was about 10, and in our testing, we always look at medications that a patient takes. And it just so happened that this patient was on a statin drug. The statin drug controls and makes the liver sick. And we know that type 2 diabetes, which is what she had, is a sickness because the liver itself can't handle or process the sugar into glycogen that's stored in the muscles. So because she was medicated to such an extent and her liver couldn't handle the sugar intake that she had, her A1C was really high. It ended up putting her in the hospital because her liver got so sick. She was in there for about a week and trying to be managed, crisis management because of that. Now we changed her diet. We reduced, she kind of had a sugar fetish. She really enjoyed eating sugar, and a lot of people have that problem. But when we cleaned up her diet and we got her, the doctor who gave her the statin drug actually agreed that we needed to get her off that. Once we got her off that medication so her liver could actually heal, then it could begin the process again of converting sugar to glycogen, and it wouldn't build up in the bloodstream. And so now she's living a pretty normal life. But the doctor says that she was pretty close to dying because her liver was in such bad shape, and it was just the weight loss that we found the liver problem, which in turn really was a diabetic condition. Very fascinating.
I probably notice a trend. Oftentimes people present to the office with things that they feel or desires that they have that are different than what their actual issue presents to be. And if we're only focused on helping a person to lose weight, but we're not looking beneath the surface to understand why they might be a little bit overweight and seeing what corresponds with that, oftentimes like a high A1C, we can miss the big picture and allow them to live a life of illness or a life that is less than ideal from a health perspective, and allow them to continue to go down that path, which is not what we want. So all of that is just to say that we can glean some insight into the couple stories that you've just heard. It's very helpful to approach a person that has diabetes from a whole person perspective and to understand what they're dealing with, not just on the surface, but underneath the surface. And our office is excellent at doing that for people in those scenarios. So the lesson to be learned is that the body can recover from a diagnosis like type 2 diabetes. when you address the right things and when you approach the situation in the right way, you can get rid of that diagnosis in a way that's very dynamic and very cool. We've seen it many times.